Hello, the topic today is, can 40 plus people hit gym, or 40 plus people can start doing exercise? Definitely yes. Age is not a criteria to start exercise or going to the gym, or even the 40 plus age is called the middle age or the midlife. This is very very important because usually after 40 years only the diseases usually, or the wear and tear problem in the body happens to come out. So we get, generally hypertension, BP, sugar, all these things comes usually after 40 years. And most of the people have that myth of saying after 40 years you cannot develop muscles. No, even whatever the age, you can do exercise and you can develop your muscles. So 40 plus years is very very important because uh, for 40 years, suppose you have a sedentary life and suddenly you start doing exercise, your body sometimes may not be able to take up the pain, and the injury can happen. So that is why I always say, if you're 40 plus and you're going to start exercise program or going to hit the gym, first and foremost is get a cardiac fitness from a doctor. Check your sugars, blood pressure, even treadmill test, get your health examined by a doctor. So let the doctor say you're fit to go for this kind of exercise. Number one. Number two, uh, next is define why you want to. What is the purpose you're going to the gym or doing exercise? You should be very clear, because some people go to the gym or exercise to lose weight, some people for health reason, some people only for fitness, some people for diseases like cholesterol, sugar, hypertension, so for disease purpose. Or even some people, they are recovering from some musculoskeletal pain or even fracture, so rehabilitation exercises. Or some people even, professional reasons. So first is get a fitness, second is cardiac fitness, second is why you want to hit the gym, third is slow and steady. Slow and steady is very very important. For 40 years you have a sedentary life, and all of a sudden you do the exercise or hit the gym, saying when I was young I was a, so a football player. I when I was young I used to be very strong. 40 plus years you may not know what is inside. Certain disease may not be evident. Some, you may not be aware of what's happening in the body. So slow and steady. So once suppose you hit the gym very hard, doing all exercise or even any vigorous exercise, the wear and tear of the body can increase and you get pain easily. Once the pain comes, most of the time we start giving excuses and we'll stop the exercise. So these three is very important. And can we develop the muscle after 45 plus years, 40 years? Yes. So proper trainer or somebody has a knowledge on this field, get a help from them. Don't just go around the Google and start doing exercise. Somebody with the knowledge, somebody in that field, they can help you out for your age, for your disease. Then it should be, see, every day we are sleeping, we are doing eating food the same way. It should be every day. So when WHO says, World Health Organization says, 150 minutes to 300 minutes of moderate exercise per week, or 75 to 150 minutes of vigorous exercise. Suppose you do exercise for 30 minutes a day, roughly in a week it comes more than 150 to 200 minutes. So every day, whether it rains or shines, whether you have a work or not, it should be 30 minutes of exercise. And weekly, at least 2 to 3 days, some interval exercises or core strengthening exercises should be done, so that you keep the bulk of your muscle. The muscle should not get wasted. So, and proper diet is also very important. And suppose you get some pain or an unusual sense, you should stop the exercise or the gym, get yourself examined by a doctor, then slowly again start doing this. So 40 plus years is the best time to invest on your health. And whether you have invested money in shares and all, but you should invest time after 40 plus years for your health. Number one. Number two, slow and steady. Slowly start, and it should be daily. Daily. That is the main thing, consistency. Number three, get a cardiac fitness. Unless you get yourself been examined by a doctor, looking for your cardiac, BP, a sugar, don't go to the gym. Fourth, it should be daily. It should be daily. Thank you.